All right. So right off the bat, I'm so prepared today that I'm going to drop the link to today's article right in the comments right off the bat.
Nice.
Yes.
Okay, goodbye.
Okay. So have fun reading it. No, actually, it is worth reading.
Actually, it is a good read.
Yeah, for sure. If you've got a few minutes to put together to go look at this, we're going to give you the details here, the important part of this particular study and everything really that you need to know. But it's not a bad idea to go check the study out and see what you can learn from it. So, welcome. This is the Laser Therapy Institute podcast. My name is Dr. Jason Roundtree. I'm a chiropractor and certified medical laser safety officer. And this is Christy. Christy is a certified laser tech, and she's also the head guru honcho of doing all of our online course development.
And I always have to say it's teamwork.
Well, it is teamwork, but that's how we make excellent online coursework. Yep, for our docs. So if you're a doctor, you want to get involved with getting trained for your use of laser therapy devices, get a hold of us. At least go check out our website, lasertherapyinstitute.org. There's a ton of free resources. There's additional research reviews, all kinds of stuff. And of course, this podcast, you can find it on Apple Podcasts, Google Podcasts, all the places, Spotify,
everywhere,
Pandora,
yep,
all of it. So scroll through the episodes, see if you find something that's interesting. This is one of several episodes where we are talking about diabetic neuropathy, and simply because there's no good solutions for neuropathies out there other than laser, really.
Right.
I mean, there's a couple other things. PRP is an up-and-coming thing that hopefully we get to see more and more research on. There is some evidence that things like scrambler therapy can be good, TENS units basically, but less so than laser therapy. And if you are working with laser therapy already, you should be treating neuropathy patients because it can do amazing things for them.
Amazing things.
Yeah.
So
You've seen it.
You've
done it.
I've done it. I've witnessed it. It's just amazing. So.
Well, the title of today's episode is neurovascular improvement with laser therapy. So we're not just talking about pain relief, because I think at this point, if you've been paying attention to laser therapy research at all, you know laser therapy can reduce nerve pain.
Right.
Absolutely.
Right.
How does it do it, and are there other benefits? That's a question this article answers. And this is a little bit older article from 2012, the Journal of Advanced Research. The title of the article is Effect of Low-Level Laser Therapy on Neurovascular Function of Diabetic Peripheral Neuropathy. It came out of Cairo University, and it's really one of the main rundowns that I have seen to not only talk about pain, but also what else changes when you apply laser to someone who's got diabetic neuropathy. So, what is diabetic neuropathy? Well, most of us learn about it in school, but it is a damage to the small peripheral nerves that causes burning and stinging. Pain happens more often in the feet than it does with the hands, but can happen in both. Stocking and glove type distribution. So we're not a mononeuropathy like carpal tunnel syndrome or Bell's palsy.
Right.
And this is a polyneuropathy. So diabetic neuropathy in particular. So let's talk a little bit about this condition first. If you're in the United States, this is a major issue. It's getting worse every year. There are more and more diabetics. There are more and more obesity problems that we're dealing with. And therefore, there are more and more of these diabetic neuropathies as well. So they say diabetic neuropathy is frequently the most common microvascular complication of both type 1 and type 2 diabetes. It is thought to be progressive and irreversible. When they say it is thought to be, I mean, that's what I was taught in school. It is progressive and it is irreversible. Thankfully, we know that's not necessarily the case anymore.
Right. Thought to be?
Thought to be. Right.
Thought to be.
Exactly.
I'm hung up
doubt
on
in
that.
there already.
That thought to be.
Thought to be? Yeah, thought to be. So, so you're going to run into a lot of patients that have been told that it's irreversible, it's going to get worse, there's nothing they can do, which is a little bit depressing maybe.
Well, we know there are a few things that people can do, control with diet and that sort of thing. However, once the neuropathy is there, you wonder, is
Right.
this going to change?
Right.
But there is hope.
And that's actually, thank you for bringing that up, because every time we talk about diabetic neuropathy here on the podcast, we have to emphasize the importance of controlling the diet, controlling the sugars, because that's what drives the inflammatory destruction of these nerves. If you have a patient who won't stop what they're doing, who won't get on the right medications, or who won't change their diet, who won't lose weight, who won't be active, you are better off not treating them in a lot of cases, because you're not going to see good progress in most cases. Now, if you got somebody who's honestly trying to make the changes they need to, start them on care, because you will at least be helping to prevent further damage, and you'll be able to keep an eye on them and help them make those lifestyle changes that they're supposed to be making.
I think you just brought up a good point. Further damage. Sometimes the damage is there, but we can prevent it from getting worse. And, with this, hopefully even getting better.
Right. Because it's thought to be progressive. So, neuropathy itself is a consequence of peripheral nerve injury derived from microangiopathy of the vasa nervorum. Nervorum. I knew I was going to screw that word up. Loss of axons and axonal atrophy as a result of the combination of different mechanisms of tissue damage. All nerve fibers may be injured. So, not just sensation nerves, but all nerve fibers, including motor nerves, including autonomic nerves, things that control bowel and bladder. Now, we're not talking about that today, but you can have bladder dysfunction due to an autonomic neuropathy that is diabetic related. You can also have cardiac problems due to neuropathy.
I'd heard of that, but I hadn't heard of the other. So that's a new, for me.
For a lot of people.
For me, that's a new concept.
Yeah. So if you have a neuropathy patient, if you have somebody with diabetic neuropathy pain in the feet or the hands or both, you should be examining their motor strength as well to see if those axons are affected, to see if those nerves are affected. You should also be checking their entire system. You should be running blood work, because you can have these autonomic and motor effects, and a lot of times they are overlooked because the patient is so focused on the pain. Or they have a primary care or a neurologist who's not necessarily doing the hard work of tracking the rest of the stuff down, because you can absolutely have all three: motor, sensory, and autonomic neuropathies happening in these patients. If that's happening, you need to know about it. Because autonomic neuropathies can be life-threatening. I mean, and these diabetic neuropathies, the sensory neuropathy side, can be extremely severe too. They go on to say that in association with neuropathy, disturbed microcirculation is responsible for the development of diabetic gangrene, ulcers, and infections of skin and bone in long-standing diabetic patients. So it's not just pain.
Right.
We're talking about significant loss and disability, and in some cases amputation for patients with these problems. So this is serious stuff. It's not just somebody who's got some tingling in their feet.
No, and we've seen the extremes. We have seen the extremes. So,
in long-standing diabetic neuropathy, they say that not only does the nerve actually die, but the repair mechanisms of nerve regeneration are also defective, impaired. So not only do you lose a nerve, but you lose the ability to maintain and repair whatever nerve you have left. So serious problems here. And yeah, we've seen serious cases. We've seen some that are early. We've seen some that have been around for a long time. We've seen wounds, diabetic wounds that will not heal. It's significant stuff. It is life-altering for patients.
Definitely. Yeah.
Current estimates right now are that about 20 million Americans have neuropathic pain from a variety of causes, but diabetes is the main cause. How many of those could potentially have autonomic problems or motor problems that don't involve the sensory system, or not severely enough for them to be noted? There's a lot of this going on.
Wow.
So almost really, no matter what kind of healthcare practice you're in, whether you're a physical therapist, chiropractor, dentist, primary care doc, oncologists. I mean, you're going to have a lot of patients who have this stuff going on. Be a part of their advocacy.
Yes.
Be a part of their care plan. Dig in and make sure they're getting the care they need. You can be changing the rest of their life if you just help them with these problems. And again, the best thing they can do, get a hold of their diet, fix that, because that will prevent this from getting, significantly worse rapidly.
Right. Wow. Do we have any good news?
Well, we got more bad news first before we get to the good news. Yeah. Okay. Unfortunately, there is more bad news. So,
well, it is a serious thing. And, and it affects, like you're just saying, so many people. And we need to get on it. We need to, unfortunately, our society is not helping with the types of choices we have readily available. And so it does take some work.
Diet is especially challenging for people. Not only are most people not informed or educated on how to even make good choices, but we are constantly thrown things with sugar. I mean, it just in your face all day long.
And I count sugar as poison. That's the way I look at it. Yeah. It's just not healthy.
No, there's really no reason to have sugar. Refined sugars in the diet.
Sugars,
right.
Yeah.
Simple carbs, absolutely.
Oh, yeah.
Low doses of natural sweeteners. Sure, you can get away with some of that, but it's generally just a bad idea to have sugar coming in.
Right.
It doesn't do anything positive for the body.
No.
So, what do we know about the standard of care for neuropathy pain? What is the typical treatment for that? Do you know?
Medications.
Yep. That's exactly right.
With many side effects.
With many side effects.
So,
this study says that current therapy for diabetic peripheral neuropathy is purely symptomatic, aiming to relieve the pain through the administration of various analgesic drugs. These drugs are effective, but no more than 40 to 60% of patients show adequate symptomatic relief. Moreover, these drugs are frequently associated with central nervous system side effects and do not slow the progression of the underlying neuropathy. So not only do a lot of people not feel better, but it does nothing to prevent it from getting worse.
That's very discouraging.
Yeah.
That's very discouraging, because you want to think that what you're doing is going to help the situation. Right. And that's what we're fed, basically, the information we're fed. But there are other things that can be done to prevent and heal.
There are.
So
we're going to talk about them here today. But this kind of stuff right here is why patients get such bad news when they talk to a neurologist about neuropathy. They're usually just handed this diagnosis and said, well, it's going to get worse, and there's nothing you can do about it. Take these pain meds for the rest of your life. Maybe they'll work. Whatever. I mean, that's pretty rough.
Yeah, maybe they'll work. They'll mask the pain for a short time, but then your body becomes accustomed to that masking, and then it just
in
starts.
Some cases.
It might, you'd have to either take more or take something different with different side effects, and then you have to take medication for those side effects, and it just spirals.
Well, yeah, it does. And the longer you take some of these medications, the more the side effects can be present too. And so, if you only had to take the medications for a few months and then it would resolve your pain, I'd be a lot less worried about this kind of thing, but that's not the case. Neurontin, which is gabapentin, Lyrica, Cymbalta, those all have nervous system effects that become more pronounced the longer you take them. I've seen patients that were on Neurontin in particular for 15 years for the nerve pain, and you're just basically losing their minds. I mean, just memory problems, personality problems, all kinds of stuff that starts piling up. And it wasn't even that effective for them, So that is unsatisfactory to me, and it should be unsatisfactory to you. It should be unsatisfactory to anybody who cares for patients if you've got a problem like that.
Patients are loved ones,
Yeah.
So.
Yep. Yeah. If your family member was going through something like this, would you be happy just handing them a diagnosis label and a medication and being like, well, good luck?
There's nothing else to be done.
That's what's happening every day, though.
That just decreases your quality of life right there.
Big time. So let's talk about the good news then.
Okay.
Since we handled most of the bad news. So researchers, knowing all this and stating all this, said, okay, we know that laser therapy has been shown to help with pain, right? In the United States, lasers are cleared to help with pain, at least on a temporary basis, but also to help improve circulation. Again, perhaps on a temporary basis. That's the FDA clearance. But we know more from the research than simply what the FDA clearance says. So this is some of that research. So these researchers went ahead and collected 30 patients, which is a small group, but still, this is a pretty intensive study. So, small group who had long-standing type 2 diabetes, more than 6 months, and complained of burning pain with paresthesia in both legs. They were excluded from the study if they had unstable glycemic control. So, if they didn't have their stuff together, they weren't in the study.
Okay.
Again, that's the most important first step you need to take, is get these patients under control. Because if you don't, there's no reason to even do this.
No.
And these researchers knew that. They said, if you don't have yourself controlled, then it's not happening. So they took these patients and they did some testing. They tested for pain intensity, which is subjective. They also tested for peroneal and sural nerve conduction, as well as foot microcirculation in the skin, microcirculation in the skin. So they checked this before, and then they applied laser therapy with a device that can do 850 nanometer infrared light, continuous wave, max power of about 10 watts. Now, this particular laser that they use is not available in the U.S. Matter of fact, it doesn't, as best as I can tell, it's not made anymore, but still we can take away somewhere in that 800 to 850 nanometer is a good zone to be, and power up to about 10 watts. They applied the laser to the lower back, as well as to the entire plantar surface, the bottom of the foot. They did this 3 times a week for 4 weeks. They applied a decent amount of treatment. They were 5.7 joules per centimeter squared. It took about 15 minutes per zone, so about 45 minutes of laser treatment per area.
Just the low back and the plantar?
Yep. Not the top of the foot.
Not the leg?
Not the leg.
Okay.
Yep. Just the low back, and then jumped down and did both the feet, just the bottoms of the feet.
Okay.
So 12 treatments, 3 times a week, 4 weeks. And then they redid testing afterward to see what the results were. So again, I already said we know that laser therapy helps with pain, right? We know that. That's a fact. So in this case, patients getting laser therapy saw a 26.4% decrease in pain.
Okay.
It's pretty good.
That is good.
26% in the course of just 4 weeks of treatment. Now, if that was what you were getting out of pain medications and you had to stay on that, I mean, that's a significant amount of pain relief, but it's not a huge amount.
Right.
The nice thing that we know from other studies and from clinical experience is that if you continue on with care, pain continues to drop. And then it stays down, even once you discontinue laser.
I was going to say that once you discontinue the treatment, it still is decreasing.
Yes. Instead of ongoing medication.
Right.
So right there, that's an advantage. Yes, it might be time demanding. It might be a little more expensive for the patient than the medications, or maybe not. But
well, when you think long term,
right,
you're not paying for medication for your life.
Right, you're not paying for laser
and you're not
for your
paying
whole
for
life either.
laser for your whole life. So, I mean, you would be paying for medication.
You would be.
And so there's an ongoing expense, whereas laser therapy is a short-term expense.
Yep, short-term expense. And then as long as you maintain your
Right.
dietary control, in at least what most of the research says, you're going to be pretty good. It may not be perfect, but it'd be significantly better without having to use ongoing meds.
Right.
So that's important that they got that pain relief. But again, they tested microvascular circulation. They tested nerve conduction as well. The skin microvascular circulation improved by 35.8% in the laser group, not in the control group.
Wow.
That's a big change.
That's
because
huge.
that goes back to what we talked about just a little bit ago, where disturbed microcirculation is responsible for those development of diabetic gangrene, ulcers, and infections of the skin and bone. So, big improvement, real big improvement in just 4 weeks. Guess what
amazing.
medications don't do?
They don't do any of that repair.
No.
They just mask the pain.
Yep. So does it really help with the infections? Does it help with wounds? No. But this does.
This does.
Because it improves skin microcirculation by a large amount in just 4 weeks.
You would consider that regeneration?
Yes, I would. I would. Absolutely.
With the circulation, regeneration, healing.
Yeah, check this out. So, in 73% of these patients, the sural nerve was dead. Zero activity. No transmission. No wonder people felt like crap.
Wow.
But every single person in the laser therapy group in this study had function return in the sural nerve after it was completely dead. 100% of patients who got laser had nerve function return in a nerve that was previously dead.
That speaks very loudly to the benefit. I mean, you take something dead and revive it, restore it.
Yep.
That's
And you
amazing.
throw in, you're getting
And you
that
throw in, you
microcirculation
get- yep.
improvement as well. Yeah, this is heavy duty regeneration right here.
Definitely.
Yeah.
Definitely.
The peroneal nerve function also improved well. The sural nerve was one that was really remarkable. But peroneal nerve function increased as well. So not only did people get less pain and better nerve conduction, I mean, we're actually bringing dead nerves back to life, improving the transmission rate, and improving the circulation to the skin. I mean, this is reversal of this condition is what it is. Not completely in 4 weeks, but significantly.
Well, you take 4 weeks and you extend that a little bit longer. Just think of the reversal and the repair and the regeneration that can happen.
Right.
That's very encouraging.
Yeah, it is.
And gives people hope.
Yeah.
So.
And you don't want to overpromise
No.
on this stuff.
No.
But if you can just get a patient to commit to 4 weeks of care, they are probably going to see significant changes, significant improvements. Again, there's only 26% improvement in pain, so that's taking somebody maybe from an 8 out of 10 to a 5 out of 10. However,
look at the other benefits. I mean, you can't just look at one piece of it. You have to kind of look at the whole and and really consider all of that and then know what could happen beyond.
Right. Most of us in clinic are not testing microcirculation, but realize that you're going to see changes in skin color, warmth, sensation, the ability to feel things they couldn't before. So if you're a clinician and you're using laser therapy for your neuropathy patients, yes, you need to chart pain. However, chart function as well, right? Do your Wartenberg wheel so you can check for pinprick, do vibration to test for large fiber. You need to do these additional tests because patients will see more improvement there as well. And they may not want to continue with care if they got, I think that's a significant amount of pain relief in just 4 weeks. But they may say, well, that's good enough for me. It was pretty okay, but it takes a lot of time to come in here and get this done. If you can show them that they're getting improvements in their function as well, that will help to encourage them to keep going. And you would like them to keep going because even though this study doesn't necessarily cover what goes on further, I'm going to tell you from clinical practice, you do this in the first 4 weeks and then you gradually taper them out of care, the improvements are astonishingly good. We're talking about another 6 to 12 treatments after this, less and less often. And the improvements are maintained and they are excellent and the patient's health is improved. We had one diabetic type 1 patient who he was in his mid-40s when he came to see us. This was about 5 years ago. 5 years ago, maybe 6 years ago now. We were earlier on. And he had already lost several toes. He had some significant color changes to the feet and lower legs. So he's a white guy. And his, brown. A lot of brown changes. I cannot think of the name for that. There's a technical name. We'll have to come back and post it later.
Don't look to me for that technical name.
But the change in skin color alone over a period of about 6 weeks was insane. Insanely good. And the reason that we were working on him because he had just had a new wound open up and he was terrified he was going to lose more of his foot.
Right.
right?
I think
And this,
I remember this case.
I bet you do. He was actually in really good shape. He did really good managing his type 1 he had for years, but it's hard, right?
Right.
And so we were able to get that wound to heal. We were able to reduce his pain. We saw visibly, could see the changes in the skin. Warm feet instead of cold.
Right.
Massive changes for this guy. We saw him again about a year later because he had, I think he had another wound that had started up because he did something silly. He was, he was pushing.
Yeah.
He was pushing a piece of equipment,
Yeah.
and he didn't have good shoes on, and he ended up rubbing. Basically a wound into the bottom of his foot. We saw him a handful of times, healed right up. He's out the door.
Right.
Yeah.
Right. Now, it is so encouraging to hear this research. My question is, you talked about the laser unit they used might not be available in the U.S.
Yeah.
What about the class 4 lasers that are available now?
Yeah. So basically, if you want to replicate this research, what these researchers did, it's pretty simple. You need a wavelength of about 850, although we know that between about 790 nanometers and 850 nanometers, the effects are very similar. So somewhere in that 790 nanometers to 850 nanometers should work. Power settings on this class 4 laser they used was about 10 watts at its peak. It's probably end up a little bit lower than that. And then you want to do enough dosage that you're getting to about 5, 6, 7 joules per centimeter squared. That's going to help you basically replicate what these researchers did. So set your laser to have, or get a laser that has that correct wavelength. That's your first step. Make sure that you can deliver that 5 to 7 joules per centimeter squared in 15 minutes or less, and you should be set.
Okay.
Now, per centimeter squared, most of the time, most patients, you're going to be talking about 200 or so centimeters squared for the bottom of a foot, and about the same for the back. So that's 200 centimeters, 600 square centimeters. If you can deliver that light a bit faster, that's fine too. A lot of the best lasers out there right now, class 4 lasers, will deliver that light in a lot less than 15 minutes. So you're not spending 45 minutes doing that.
Well, that's kind of where I was headed. You can get units where it will be less time for the patient,
right?
More efficient for the clinic.
Yeah.
That sort of thing. So
I've got a laser here right now that can do a treatment like this in about 6 minutes. So, it can be, actually could do it a little bit faster than that if we want it to. Could be very, very good. We have an older laser here that could do that in probably about 12 minutes, and these are not expensive machines. If you want to get one of the older ones, it can do people a lot of good.
Well, and the thing is, too, looking at the time frame it takes the patient and even the clinic is very minimal compared to the results and the effectiveness of it.
That's right.
I don't mind spending 45 minutes a week if I had to be healthier and feel better and
right.
Do something that will help whatever condition.
Right. Yeah.
So it's all perspective.
It is. Help your patients see the perspective on this, because if they're feeling better, then more than likely they're having better nerve conduction. They're having better microcirculation. Not only are they just having the symptomatic relief, they're probably getting this tissue regeneration effect as well, and that is important. It is critically important.
That's a huge, huge increase.
Yeah, it's cool
Amazing stuff. I love it.
If you want more information, you can always get a hold of us. info@lasertherapyinstitute.org is our direct email. And again, please check out the website. We have a lot of resources there, additional research. If you want to know, what kind of laser you should be buying, we have webinars on that. If you already have a laser and you really want to hear more about treating neuropathy, we have recorded webinars you can access right now on the website. Just go to the, I think it's under the resources tab, go to webinars. Yep. You can go watch that right this minute. All we need is just your email address so we can track who's getting what, when, where. Because we want to know how we can help you.
Yes. We want to help you help others.
That's right. the more we can head off this problem now, the less amputations we're going to have, the less disability all of our grandparents would have. I mean, you know, there's significant changes for our society if we can get more of this out there. So please be a part of that.
Yes. Thank you.
Thank you.